Hello and welcome, everybody. So excited to be here for another episode of King County Recovery Conversations. My name is Brad Finegood. For my day job, I work for Public Health, Seattle, King County, but I'm here in my role as a board member for the King County Recovery Coalition. Let me try that again. King County Recovery Coalition and the Washington Recovery Alliance. It's an honor to be here today for another episode of King County Recovery Conversations. And even more than just being here, it's a bigger honor to be here with my friend and colleague, Apoorva Mallya, with the Hepatitis Education Project, HEP, here locally in Seattle, that does just so much amazing work for the healthcare of our community and those that are marginalized citizens and community members. So Apoorva, maybe we can kick it off by you introducing yourself a little bit, and then we can get deep into our recovery conversation.
Well, thank you, Brad. First of all, it's really an honor to be here. You are a close friend and a great colleague. So it's a pleasure.
Thank you.
My name is Apoorva Mallya. As you said, I'm the executive director of a local nonprofit called the Hepatitis Education Project. And we do all things to combat viral hepatitis, in addition to a lot of work around harm reduction. We are here as a local organization here in Seattle. We've been around for 30 years, and we're just excited to participate in this podcast today.
So good, so good. And maybe we can get started off by an article that I had the honor of reading, that you had the privilege of writing, that was recently published around getting tested for hepatitis and the importance of it. Do you want to tell me a little bit about this article? And then maybe you can jump in and tell folks who are listening or watching here today why it's super important for people to get tested for hepatitis.
That's a great place to start, Brad. And it was really an honor to write the article. It appeared in Real Change as an op-ed. We're big fans of Real Change. It's a great local newspaper here in Seattle that gives a very unique perspective on key local issues that we're all talking about, that we're all dealing with.
Yeah.
So it was really an honor to write about hepatitis and the importance of hepatitis for our broader community here in Seattle. And really the story around hepatitis and the need to get tested is that hepatitis is actually one of the most devastating diseases in the world. It kills more people every year than HIV or malaria, and sometimes doesn't get as much notoriety or support. And actually, more than 4 million Americans are infected with hepatitis, and it's mostly hepatitis B and hepatitis C. And you know, one of the kind of tricks about hepatitis is it doesn't always manifest itself right away.
So it could be latent.
It can be latent. So a lot of people can have hepatitis, can have the virus living inside them, but they don't exhibit too many symptoms, or the symptoms kind of show up over time. And of course, it is a killer. So people get cancer, people need liver transplants, and it can cause just a lot of complications in someone's life. Now, the good news is we have a lot of great tools for hepatitis, both hepatitis B and hepatitis C. If you come in and you are to a clinic, a provider's office, it's very easy to get tested. It's a simple blood test.
Anybody can get tested anywhere at any provider's office?
Absolutely. Really, almost any provider out there, pharmacies, health clinics. Of course, your doctor's office will be able to provide testing for both hepatitis B and C. Super simple. You get the result in a couple of days. And I'll tell you if you're positive. And if you're positive for hepatitis C, let's start with, there's an excellent treatment out there that we can get you on. And really, it's a cure. Mm-hmm. So the vast majority of people, 98% of people who start treatment for hepatitis C are cured. There is no more hepatitis C virus in their bodies. It's quite dramatic, and it's really a miracle of modern medicine.
Yeah.
So that is one of the key points. And if you're negative, we can tell you all about how to stay safe, how to keep yourself protected, and we can get into that a little bit later. For hepatitis B, on the other hand, if you're positive, we do have good treatments available. It's more about managing the disease, and the disease can be managed with effective treatment over a very, very long period of time, which can save your life, protect others from getting infected.
And improve quality of life too.
Improve your quality of life over a very, very long period of time. And then if you're negative, we have a vaccine for hepatitis B that is
Amazing.
extremely effective. It requires 2 to 3 doses, and you're protected for life. So we have tools out there, and that's why we think these diseases, they really affect and actually kill a lot of people.
Yeah.
So we think it's really important for everybody to take that first step and go get yourself tested.
That's great. Thank you, Apoorva, for that level of baseline education. So one of the things I've learned about these King County recovery conversations that's amazing is that we get to share education for the community. One of the downfalls of these King County recovery conversations are they're only about a half an hour because I want to have this conversation with you all day long. Can you tell me just a little bit about then what HEP or Hepatitis Education Project, how you play a role in prevention and treatment of hepatitis?
Yeah, definitely. So we as the Hepatitis Education Project, our mission is to combat viral hepatitis. And that's really what we're striving for and fighting for. We do it in a variety of ways. We have a policy and advocacy team at the national level that works with government leaders, other leaders across the nation to really find ways to put policies in place that are favorable to getting more people treated for hepatitis, more people tested, et cetera. We do also work here across the state of Washington. We do a lot of education and training as well as advocacy to work with organizations who are working with people at risk of hepatitis. And in support of Washington State actually has a hepatitis C elimination plan.
Amazing.
That they're targeting to eliminate hepatitis C in this entire state by 2030, so not too far away.
Yeah.
And then here at the local level, we do a lot of direct work with communities who are most impacted by hepatitis. And for hepatitis C in particular, it is a disease that is mainly transmitted through injecting drug use.
Got it.
So the majority of cases for hepatitis C are going to be amongst people who use drugs, people who are experiencing homelessness, and people who are incarcerated. And so we've designed and tailored our programs to be able to serve those people. And for example, when we are serving communities where people are using drugs, we want to be able to provide services beyond a hepatitis C test. So we have a full harm reduction program. We have an opiate treatment program. We have a needle exchange. We just have a sort of a welcoming space to bring people in.
Why is that important? Why? So this wide array of services, like, in the location that you serve the community, why is that important to provide engagement for people who are who may be using drugs or other types of at-risk folks in order to further your mission around hepatitis elimination and testing and treatment?
That's a great question. And there's 3 main reasons. Firstly, actually, one of the components of our harm reduction program is to provide clean, safe needles for people to utilize. That providing someone with clean, safe needles when they're utilizing drugs is actually a direct way to lower transmission. So now instead of sharing needles, they have an opportunity to use clean needles and not transmit hepatitis C. Hepatitis C is really one of the most transmissible viruses out there. Even a small amount of hepatitis C on a needle can survive days, if not weeks, and still infect another person who comes into contact with that needle. So that's one kind of very, basic fundamental reason why it's important to kind of get clean needles out there. Secondly, our broader harm reduction program, we're trying to build a relationship with communities. We're not just trying to say, here, come get tested for this one disease, and that's it. We want to build a relationship of trust. So we want to find ways to provide services that are going to attract communities, are going to meet other needs of communities and people. So that's a second reason that we want to have a broader spectrum of services. And then thirdly, sometimes it goes the opposite way. So sometimes people come in for hepatitis C testing and treatment, and then they say, oh, I'm comfortable with you guys. I trust you guys. I want to see what more you can offer me. And at that point, we can offer them opiate treatment if they are in a place to get opiate treatment. So we have a lot of people who go through hepatitis C treatment.
So you have treatment available on site that you can link people with.
We can link people right there, very low barrier, sort of no appointment necessary, no pretty
Just
basic
right there,
information, and we can get you right in. And So it's kind of a journey that works both ways, and we just want to be able to have services that are going to meet people where they're at. So
Yeah.
if people are coming in for opiate treatment, maybe they can get Hep C tested. If they're coming in for Hep C testing, maybe they can gain access to clean needles. So it's this whole process that we just want to make sure that we're utilizing every opportunity to do work on hepatitis, but also build these relationships and treat the whole person.
Yeah, I hear you talking a lot about relationships with people, about trust, acknowledging that like when people are struggling with their drug use, often there's a power differential that happens by being a service provider versus versus walking in and needing services and help. So, what are some of the ways that your organization builds trust for people who need help and need your services?
That's a great point, Brad. And trust is a big deal. So many of the communities we serve, there are trust issues between themselves and the kind of mainstream medical system. Not everyone wants to walk into a fancy doctor's office, and
Yeah.
not everyone feels comfortable, and not
Yeah.
everyone trusts what they're hearing or what they're saying. When we talk about building trust, we think it's important, firstly, because it results in better patient outcomes. We find our community do better and receive more services and are more successful. The way we do that is firstly just by being there, so being open, being available, welcoming everybody. Secondly, compassion and dignity are core values for our team. We always want all of our services to be delivered in a way that's person centric. That is delivering it from one human to another. Power dynamics are always going to be there, but to the best of our ability, if we can just make this an exchange between two human beings and fill that interaction with compassion and dignity, we find that's a great way to build trust. And then we do take the effort to, not just hand someone a wound
Sterile
care kit or
equipment.
sterile equipment or, whatever the other services we're offering. We want to talk to people and we see familiar faces and, actually sometimes people come to us for years before they're
Yeah.
ready to get a Hep C test.
Yeah.
And sometimes they come to us for years before they're ready to start opiate treatment. But we want to be there when they're ready, and
They know you're there.
and we want we want to be one of the channels that's available.
That's right.
When they are ready to say, "Oh, I know the folks at HEP. I really like them. They did great work here. I want to now take the next step in my health journey."
Yeah, amazing. One of our mutual colleagues, Thea Alfont Wells, who just has an amazing story and an amazing journey, educated me that harm reduction is healthcare. And listening to what you're saying, whether it's providing sterile equipment so that there's a lower likelihood or no likelihood of transmission of a highly transmissible disease, providing treatment for somebody's opiate use disorder on site by building that relationship. The thing that continues to resonate with me, that the services that you're providing, that the harm reduction and engagement services is really healthcare. Can you talk a little bit about that?
That's a great point, Brad. And I think everything that we do, from needle exchange to giving basic health kits to hepatitis C testing, it is all well documented in scientific medical literature that these approaches work. They actually result in clients, participants, communities being healthier than when they started. There is a vast amount of literature on this. So Thea is absolutely right. Harm reduction, the services that are encompassed within a harm reduction program are healthcare. It's just like, taking medication for, a upset stomach. It's going to get you better.
Yeah.
This also will get you better, will result in a better health outcome, whether it's prevention of infectious disease, whether it's taking you on a path to being interested in substance use treatment. There can be so many ways, but it is well documented that these approaches actually result in better health outcomes.
Yeah, it's amazing. And we're here today as part of the King County Recovery Coalition podcast, the King County Recovery Conversations. And so it also makes me think about people's recovery journeys and where people's recovery journeys start and maybe where they go. I was having a conversation earlier today with another colleague about when they entered recovery and the people that they knew who entered recovery, like a vast majority of people were in remission or or had been treated or no longer had hepatitis C. And so it so do you want to talk a little bit about the nexus between your work and folks in recovery, the impact that it can have on long-term recovery?
Absolutely. It's a great question, Brad. And I would just say, first of all, whatever stage of recovery someone's been, whenever the last time they used the last time they injected drugs, I would just kick off by saying there is always a risk of being infected with hepatitis C. You could have gotten infected 6 months ago. You may have gotten infected 6 years ago or 10 years ago, and you may have not used injecting drugs in 10 years. And that's wonderful. And you may be at one stage of your recovery journey, but it still means you might have gotten infected with hepatitis C at one point or another, which is the huge importance of getting tested and taking that first step.
Does if somebody has latent hepatitis C and there's no like outward effects necessarily, will it show up still so that people know?
Mm-hmm. Yeah, so we will do, essentially when you come in for a test, most of the time you're going to do essentially 2 tests in that visit. The first test is called an antibody test, and that is just a simple prick of your finger. It usually takes 20 minutes to get a result, and either you'll be positive or negative. If you're negative, that means you have never been exposed to the hepatitis C virus in your life, and it's really just important to stay safe. If you are positive, it can have a couple of meanings. It can mean that at one time you were exposed to the hepatitis C virus, but your body naturally cleared that virus out of your own body. It could mean that you also actually have an active infection. To tell the difference between that, we're going to do a second simple blood test. Usually takes a few days. We have to send it to the lab. It's a quick blood draw. We get your blood. We send it to the lab. Get the result in a few days, and then we can tell if you're truly positive. And it really doesn't matter if you have shown any symptoms or not. You can still be positive. And I'll just add one thing, Brad, is hepatitis C. Actually, even though it may not be showing symptoms of like a intense hepatitis C infection damaging your liver, there are a number of manifestations that even a very kind of slow-acting hepatitis C virus can have. It can make you feel worse. It can affect your other organs, and in small, subtle ways that you may not attribute to hepatitis C.
Sure.
But a lot of people who then get treatment say, "Oh, I actually feel a lot better. My headaches are gone, or my eye soreness is gone, or I'm not suffering. I had some heart challenges before." So it's kind of impressive that you may not be attributing to these symptoms to the hepatitis C virus, but once you take the treatment, you just feel a little bit better.
I was going to ask, there may be people who are listening to us today who are in long-term recovery. They might be in recovery for years and years and have never been tested for hepatitis. So if there are symptoms to keep an eye out for, what are some of those symptoms? You just mentioned some of them, but is there any other symptoms that we want to make people aware of?
I mean, I think those are, the main ones, general malaise. There can be some fever and some other factors. But it's not always easy to tell until you get to those very, very, later stages of when you're going to be really, really sick, and it's going to be obvious that you need to go see a doctor. It's a lot of the symptoms tend to be generalized.
Yeah.
and non-specific. And so really it's just important to go ahead and get tested no matter where you are in your health journey, in your recovery journey.
That makes a lot of sense. You know, the thing that I was just thinking as you were talking is about stigma and internalized stigma that people have about substance use disorder, and then externalized stigma that people might feel from the community. So is there a way that people can feel safe in having conversations with medical providers, or or maybe they come into a specialized care facility like yours? Are there any recommendations you have on how to have a conversation?
That's a great question, Brad. And, firstly, I would say that we're all on a journey towards better health.
Yeah.
And whether it's whatever stage you are in recovery, or your people having struggles with substance use, we're all on a journey towards how can we live a bit better and healthier. And what I would say firstly is hepatitis C testing and treatment is it's another part of that journey.
Absolutely.
There's going to be many things that you do to help your own healthcare. And I would firstly just view this as another step.
Yeah.
And so what I would say in terms of stigma, yes, it can be stigmatizing. It can also be traumatizing, and it can, people can be reliving or reflecting upon times that maybe they were struggling a bit more. So I get that. I have found that, certainly our organizations and a number of, small community health centers and most physicians and other providers who are treating hepatitis C, they understand this.
Mm-hmm.
They understand that what people have gone through. They understand how to approach this in a way that's non-stigmatizing and that's welcoming. I would say is the recommendation is not for any specific person or group or community to get tested. The recommendation is for everybody to get tested. It is no judgment on whatever you've done in your past or have not done. If you are an adult in the United States, there's more than 4 million people infected with this disease. It's out there. You need to go get tested. It's important for every single person. So I'm hoping that piece can really alleviate some of that stigma. And really every provider, every medical provider, when a patient comes in for a checkup or for some other condition, and they see they have not getting tested for hepatitis C, they should be offering that test right away.
Yeah.
Absolutely, 100%.
No matter what, for any general checkup, I think I'm a mid 40-year-old male, and I went to the doctor, and the first conversation my doctor had with me was about colorectal checkup and stuff like this. And so what I hear you saying is this should be part of the standard routine.
Yeah. And I think that is, that's a kind of a newish recommendation, sort of from the CDC and the higher levels that kind of publish official medical recommendation. And so that kind of absorption of that knowledge and that, approach by the broad group of providers is slowly happening.
Yeah.
And you probably see it more and more. But yeah, I mean, it is really important for all providers to be offering this to every single individual who comes in.
Great. And I'm sorry for the listening world about my TMI, about my medical.
I'm in the same boat.
I know, right? Right. It's definitely one of those realizations that I'm having in life, amongst many other things. Man, I've learned so much just having this conversation with you today. I know a little bit that your background is a lot in global public health and stuff like that. So what's it been like for you coming into the Hepatitis Education Project as, I guess you're not new anymore, newish, still executive director. And has there been any sort of profound learnings that you've had in your experience over the past, couple of years in coming into this work and this job?
Yeah, it's a great question, Brad. So, before I came into this job, which is now 10 months, so it's still newish, and I will
I feel
still
like I've known you my whole life.
I will still say dumb things. So
Yeah.
that's my excuse. But I spent 15 years at the Bill and Melinda Gates Foundation doing really global public health and a
Yeah.
focus on childhood vaccines and even more specifically about getting vaccines out to kids for polio and trying to eradicate polio as a disease. Um, Coming into this space and working with the Hepatitis Education Project and partnering with organizations like King County Recovery Coalition and Public Health Seattle King County, excellent organizations. It's really amazing to have the focus on our local communities. And really a focus on the communities that are most marginalized and most vulnerable. It's been eye-opening, it's been revealing, and I can just see the actual critical importance of the work that we do right here, right down on the streets that we're walking on, and amongst the people in our communities. And so it's really an honor to be able to be part of the team that opens our doors and
Yeah.
serves, the people in our communities who might be struggling the most,
Yeah.
may not have a place to live, may be struggling with substance use. I feel honored every day to be able to be part of the team that opens the doors and says, please come in and what can we do to help you?
It really is a humbling experience to be in a position to be able to give back to the community and to be able to be in a position to provide help. I feel that every day in the work that I get to do. It's wonderful. There are a lot of people that call sometimes and they're like, how do I get involved? What can I do? How can I give back? So when people call the Hepatitis Education Project, when people call HEP, when people knock on your door and they want to give back, is there any how can people get involved if they're interested in getting involved, whether it's like volunteering at your agency, is advocacy? Any thoughts on that?
Yeah, that's a fantastic question. And I think there's probably a couple of main answers. One is just make sure you get tested.
Yeah.
Number one thing, and make
Personal
sure
responsibility.
and make sure your family and friends get tested.
Yeah.
That would be the biggest ask. You will be we're using this term HEP champion.
Yeah,
So we will
yeah.
call you a HEP champion if you go
Do you
out
get
there.
like a certificate
We'll
or a
definitely
badge?
we'll get you
something.
we'll get you something.
Keychain, something.
You will be a HEP champion, and that is saving lives.
Yeah.
That is directly saving lives. So it is really critical to do that. Secondly, we would love people to volunteer.
Yeah.
We have lots of opportunities to volunteer. We think we have great opportunities because a lot of our volunteer positions are client facing, directly interacting with people who are utilizing our services. Please give us a call or send us an email and we'll hook you up.
People can, it sounds like in those two things, first of all, taking personal responsibility and educating your loved ones and educating about testing and getting testing yourself really can go a long way for starting to change the tide, right? And then being able to come into your agency and volunteer, work with clients to be able to get that satisfaction of working with people directly and seeing how grateful people are often to provide that help is just a really meaningful opportunity for people.
Absolutely. I think you stated that perfectly, and that's exactly what we would sort of have opportunities for people to do.
Awesome. So, these conversations are, and like I said, I mean, we'll again have this conversation for the rest of our working lives and maybe a couple of days afterwards, and stuff like that. Unfortunately, for the recovery conversations, we have a time limit, but we're coming up on that. But before we go, is there anything for sort of the general public, the community, that you want to leave them with? Any words or thoughts that you want to leave before we time out here today?
Yeah, thank you, Brad, and really have enjoyed this conversation. I would say two things I would want to leave people with. Firstly, the one thing that we didn't really talk about in terms of the technical aspects is the treatment itself.
Yeah, please.
And so, as I mentioned, it's really effective, 98%. Sometimes we get data showing 99% or even 100%
amazing.
effective. And that means you will get cured. On top of that, the treatment has come a long way.
Yeah.
So there's a lot of kind of remembrance out there to a time before about 10 years ago when the treatment for hepatitis C was not that good. It was really kind of equivalent to chemotherapy. It was very challenging for the body to adhere to. Nowadays, the treatment is worlds better, very effective. It really consists of taking a couple of 1 to 3 pills a day for about 8 to 12 weeks. Typically, side effects are pretty minimal. And again, once you get to the end of that, you're cured. The virus is out of your body.
So with the side effects sound very different than it used to be.
Absolutely. Yeah. Most people have generally minimum side effects. Maybe in the first week you feel a little bit tired as your body gets used to the medicine. But it really works, and it's really doable for the vast majority of people. The other thing I want to leave people with is that, this is all part of a health journey, and we understand and we want to support everyone's health journey,
No matter where they're at,
no
in
matter
that health
where
journey.
they are at, and we want to find to help them to get to that next step for better health. So if they're in recovery right now, have been in recovery for 10 years, are currently injecting drugs, and are thinking about substance use treatment, we want to have all those avenues open for people. And also we want to say, hey, it's important to also get tested for this and take care of another aspect of your health journey.
Yeah.
So we want to be very respectful for that whole person health journey and just make sure that everyone has access to these wonderful tools and treatments.
Because there's prevention, there's treatment, and there's recovery for people along this journey.
Absolutely.
It's amazing. I can say, well, let me say thank you for a couple things. Thank you for being here with us today. Thank you for having this conversation. But thank you for doing the work that you do. And me also personally knowing your predecessor, Michael Nimberg, and the leadership that HEP and the Hepatitis Education Project has provided from a public health perspective and a recovery perspective in King County, the state of Washington, nationally and globally. It's just such an honor to be here with you today, and so much thanks. I know a number of people in the community, in my community of friends, who have benefited from the services of the Hepatitis Education Project, and are probably alive today because of the services that you all provided. So my indebted thank you to you and to the organization and to all the people who come to work every day and volunteer at Hepatitis Education Project.
Thank you, Brad. And let me thank you. Let me thank the King County Recovery Coalition. And let me just double underline that thank you to the staff and volunteers who come in and really do the amazing work. I am very, very blessed to work with just an incredible team of people, and also an incredible group of partners like yourself. I think we really have a strong community here in Seattle, across King County, that we're doing some great work together.
Well, rest assured, the Love Fest will not end here now. But as we come to a close of this King County recovery conversation, on behalf of Executive Director Apoorva Mallya from the Hepatitis Education Project, my name is Brad Finegood, and thank you everybody for tuning in.